Thank you for joining today's call. Your telephone line has been muted in order to eliminate background noises. At the conclusion of the presentation, all participants will have an opportunity to dialogue with the presenters. I would also like to remind participants that today's call is being recorded. Your host for today's conference is Mr. Bill West. Bill West is a compliance coordinator in the compliance branch at the Division of Practitioner Data Bank, Bureau of Health Professions, Health Resources and Service Administration, U.S. Department of Health and Human Services. The Division of Practitioner Data Bank is responsible for the management of the National Practitioner Data Bank and Healthcare Integrity and Protection Data Bank. As coordinator, Mr. West is part of the team involved with the initiatives related to compliance, monitoring, and technical assistance for the division. Thank you, Mr. West. You may begin.
Thanks so much, Daniela. And good morning, good afternoon, everybody. Thank you so much for joining us today for our presentation on Data Bank Report Forwarding. Here's an overview of our session today. I will give you some background about us, and then my colleague, Regina Keegan, will guide us through the details of the report forwarding material. Some of the information we cover today will be pretty detailed, so I want you to know that we'll have a question and answer session following the slide presentation. And also the webinar will be available to you following the session for your reference. Also following today's presentation, we'd be happy to be in touch with you to answer any additional or follow-up questions that you may have. So the functionality and usability of the DataBank website is continuously being worked on, and updates are made to the website on a regular schedule. The report forwarding features we discussed today will become available to you beginning next week on January 23rd. First, a few words about us. The Division of Practitioner Data Banks, or simply the Data Bank, is part of the Bureau of Health Professions. The Bureau of Health Professions is one of 6 bureaus and 9 offices that make up the Health Resources and Services Administration, or HRSA. HRSA comes under the umbrella of the Department of Health and Human Services, and HRSA is the primary federal agency for improving access to health care for people who are uninsured, isolated, or medically vulnerable, and provides leadership and financial support to healthcare providers in a variety of settings in every state and U.S. territory. The mission of the Bureau of Health Professions is to increase our population's access to health care by providing national leadership in the development, distribution, and retention of a diverse, culturally competent health workforce that can adapt to the population's changing healthcare needs and provide the highest quality of care for all. The Division of Practitioner Data Banks, or just Data Bank, as part of HRSA's Bureau of Health Professions, is committed to the development and operation of cost-effective and efficient systems that offer accurate, reliable, and timely information on practitioners, providers, and suppliers to credentialing, privileging, and government authorities and licensing boards like you. Here's a very brief summary of our authorizing legislation. The Data Bank was established through the Healthcare Quality Improvement Act of 1986 to act as an information clearinghouse related to the competence and conduct of physicians, dentists, and other healthcare practitioners. The Healthcare Quality Improvement Act's intention is to restrict the ability of incompetent physicians, dentists, and other healthcare practitioners to move from state to state without disclosure of previous medical malpractice payment and adverse action history. This allows the Data Bank to act as an information clearinghouse to collect and release certain information related to the professional competence and conduct of physicians, dentists, and other healthcare practitioners. Now let's switch gears and show you more about the new electronic report forwarding features that will allow reporters to automatically send a copy of their reports to state licensing boards. To provide some context for the electronic report forwarding features, it's important to know that by law, the reporter of medical malpractice payment reports, clinical privilege action reports, and professional society membership action reports must share a copy of the report with the appropriate state board or licensing authority. As you will see, the report forwarding features facilitate this interchange between the reporter and the State Board or licensing authority, and provide notifications between the two from the beginning of the process to the very end. Let me introduce my colleague, Regina Keegan, who works in this area and will take us through the next slides. Regina?
Thank you, Bill. I'm very happy to be here today to speak about electronic report forwarding. As Bill said, organizations that report medical malpractice payments, clinical privilege actions, and professional society actions must, by law, send a copy of these reports to the appropriate state licensing board. Currently, the databank reminds reporters to mail a copy of their report verification document to the appropriate board. Electronic report forwarding will enhance this system. At the present time, on the temporary record of submission, you'll see a notice that says, you must send a copy of your report to the appropriate state licensing board. With electronic report forwarding, the databank will become the conduit between the reporter and the board. What electronic report forwarding will do will give the reporter the opportunity to notify the state board. But for this to take place, several things must happen. First, the boards must opt in to report forwarding. Secondly, the boards must identify the practitioners that they license. And thirdly, the board must be active. The databank does not assume responsibility for forwarding reports. That always ends to the reporter. The reporter must choose the correct board. But if the board that they desire has not opted in, the reporter is still responsible to forward a paper copy to the appropriate board. So in order for report forwarding to work, both sides must agree. The boards must first opt in and declare what practitioner types they license, and secondly, the reporters must choose to forward each report. So let's take a look at how the board would opt in to set up report forwarding. At first, we would log in, and on the confirmation page, hit Continue, and then we'd select Administrator Options. Now, under the Administrator Options, there's a new button that state boards will see. It's called a State Board Profile. All state board entities will have this new Administrator option. On the State Board Profile screen, all state boards will be asked to verify the healthcare practitioner types that they license or certify. Based on your entity's reporting, this history will be available. Each state board must make a selection in this area. For now, we're going to select physicians. Additional healthcare practitioner type titles will also be available. For this presentation, we are going to select physician assistants. And at the bottom of this page, you will be asked a question. Do you agree to receive report notices electronically? I agree, do not agree. Once you agree and click Continue, you will be brought to the State Board Profile confirmation screen. It says, it will give the list of the practitioner types that you license, but also a very important component, you'll see it says, you have agreed to receive electronic report notices. All right, so now the board has agreed to receive these notices. Let's see what happens when a reporter sends it. Let's start with a new report. For the purposes of this demonstration, we're going to select a medical malpractice payment. We'll select physicians. For report types that can be forwarded, the language here is changed to indicate that this choice will consider when sending to the state board. The report input screen is just the same as it always has been. But when we get to the state licensure information and fill out the licensure and continue to the bottom of the form, the Continue button has replaced the Submit button. On the next screen, which is the notifications option, you'll see that the state board shown on this screen will be based on the primary license of the subject. This will either allow the reporter to send an electronic report notice to the board, or the second option is that I attest that I will provide a copy of this report to the appropriate state board when the report verification document becomes available. Either way, the reporter is indicating what they will do to notify the board. If there is no state board available for this selection, the reporter will only be given the option of printing and mailing the report. At the bottom of the page, after the attestation is made and the certification is put in, we'll submit this report to the databank. As you see on this temporary record of submission, there is no reminder. If Send Electronically is selected, then we do not include those instructions on this part of the report. But at the bottom of the page, you will see that the temporary record of submission will show the name of the selected state board, or it will show that the reporter has opted to print and mail a copy of the report. Okay, so now the report is on its way to the board. It's been submitted to the databank, and the notification goes out to the board. The first thing we do is send an email to the state board to log in to the IQRS. Log in, and on the registration confirmation page, at the bottom of the page, there will be a notice that you have received an electronic report notice. We'll select Continue, and under the Report Options screen, there will be a report update. It will say One Unviewed Report, and that will take us to the Report Update screen. Here we have the DCN number, the subject name, the subject source, and the disclosure reason. Under the disclosure reason, you will notice it says Notice of Action. Let's click on the DCN number. That brings us to the Notice of Action screen. However, before the report displays, the user must verify that the subject of the report has been or is licensed or certified by your state board. We will give you the name of the reporter, the name of the practitioner, the license number, and the practitioner type. You will have the opportunity to select, I verify my state board is or has been responsible for licensing or certifying this subject, or I verify that my state board has never licensed nor certified this subject. If the latter is chosen, a warning notice will appear. This notice of action will be permanently removed from your report update screen. This warning is permanent. For this purpose, however, we're going to verify that the state has been responsible for licensing this practitioner and select Continue. A report disclosure notice will appear. Select Continue at the bottom of the screen, and now the medical malpractice payment report that was just submitted by the reporter has now been sent to the state board. The state board has opened the report and has received the report. Let's see what happens from here. So the reporter now will get a confirmation that the report was received. The first thing we'll do when the state board views the report is that we will send the email notification to the entity's user who submitted the report. A database correspondence will also be posted, and it will say on the date that the report was sent, this notice of action was viewed by the state board on, and it will give the date that it was open. You have met your legal obligations under federal law to notify the appropriate state board of your report submission to the databank. Now, if the state board has not viewed the report within 1 week, we will send this email, and it states, your legal requirement to send this report to the state board under federal law has not been fulfilled. To fulfill your legal requirement, you must print a copy of the report verification document and provide it to the State Board. This notifies the reporter that the legal requirement has not been met and that the State Board has not viewed this report, so that they may complete the process and mail the report to the appropriate State Board. Now, if the State Board declines to view the report, we will send this email notification as well. It says, an electronic notice was sent. The State Board indicated that it has never licensed nor certified this subject of the report. Your legal requirement to send this report to the State Board under federal law has not been fulfilled. To fulfill your legal requirement, you must print a copy of the verification document and provide it to the appropriate State Board. You may wish to review the report and verify the licensure information. This is a very important part of the verification process. In order to make sure that the reporter has selected the correct licensure information and has selected the appropriate state licensure board. If not, this gives the reporter the opportunity to go back into the system and select the appropriate state board. Now, in order to facilitate all this activity for the state boards, on the monthly summary, we will indicate when your organization has received electronic report notices and how many have remained unviewed. In order for this process to work, the state boards must opt in and the reporters must be aware. Report types that must legally be forwarded are medical malpractice payment reports, clinical privilege action reports, professional society membership action reports. This is not an automatic system. Boards will not be notified automatically when reports change. Reports will be forwarded only at the direction of the reporter. The reporter is always the starting point for a report to be forwarded. And to notify the reporter of that loop being closed is when we send the verification that the report has been viewed or not viewed. Initially, this functionality will only be available through the IQRS.
Regina, thanks so much for taking us through these scenarios. As I mentioned, we're available on an ongoing basis to assist you with questions or resources or concerns you may have. And our help desk staff will be able to assist you further with this new feature as you get started with it next week. Of course, if you have any difficulty in finding your answers, you can also contact me, call me, or email me, and I'd be happy to try to provide you with further assistance or research to get you the information you need. In closing, let me thank you for your attendance and thank all of you and your staff members who work so hard with us to make the reporting process as complete and up-to-date as it can be. So this concludes our slides, and Daniela, you can open up the session for any questions that anyone may have.
Thank you. We're ready to begin the question and answer session. To ask a question, please press star 1. You may withdraw your question by pressing star 2. Once again, to ask a question, please press star 1. One moment, please. We have a question from Miley Williams. Your line is open.
Hi, how's everybody doing this afternoon?
Miley.
Hi, Miley.
How are you, Bill and Regina?
Great.
Good.
That's good. I did have a quick question for you. We are currently moving into continuous query world. If we're doing continuous query on all of our practitioners where we get notified of any changes, is it going to be like a double notification if somebody goes in and reports the med-mal, or wouldn't we normally receive that through the continuous query anyway?
Well, yes, if you have them enrolled in continuous query, it would still go through that continuous query process.
Okay.
However, with report forwarding, this is strictly for the practitioners that are licensed or have been licensed in your state. So, for example, if you had a practitioner that was at one time licensed in your state but isn't currently, and isn't currently on your rolls, if, for example, they had a med-mal practice payment that settled and it was several years old, we would send you that notification if the license that we are given is the license number for your state.
Okay.
Does that make sense?
Yeah, it does. It does. Because the way Florida law works is if they're not currently licensed with us, we'd have no legal jurisdiction to go after them for anything or any type of discipline. So I'm really thinking that in our scenario where we're going to the continuous query, this would potentially put more of a workload on us because we'd be reviewing possibly 2 reports versus just the one that would capture what we needed.
Hi, Miley. This is Cindy Grubbs.
Hey, Cindy. How are you?
I'm good, thank you. So you're right. If you're using continuous query, it probably is pretty much a redundant effort.
Okay.
But it's our data reflects that there are very few state licensing boards that do use continuous query.
Right, right.
And by law, the reporters must send a copy, so you should be getting duplicate copies anyways of the malpractice and the clinical privilege.
Gotcha.
The other advantage of using the continuous query is that you will get other state licensure actions, whereas the report forwarding legal requirement is not for state licensing boards. So we're really trying to assist all of the other boards that do not use a continuous query.
Right, right, and that's what I was understanding when Renee and I was just sitting there talking about it briefly, and I got to thinking it's a wonderful thing, but if we're getting it through continuous querying, you know, and hopefully we'll be moving in that direction within the next month. That's what we're hoping with.
Great.
Yeah, we'll be receiving what we need on our end, so, yeah, okay. Okay, well, that answered my question because, you know, it was trying really hard to think about do we want to opt in for this or not. But if we're receiving everything that we need to do what we're statutorily required, we probably won't be opting in for this.
As long as you're doing that for all of your practitioner types.
Yes, everything, and that's exactly what we're doing because, yeah, I know what you're saying.
All right.
Thank y'all.
You're welcome.
Once again, ask a question, press star 1. Our next question comes from Kathleen Richard. Your line is open.
Hi, good afternoon. We just have a question about receiving notices. We currently have about half a dozen folks with accounts to receive notices within the databank. Will each of those people be notified if they're registered as a user to receive these reports, or it will just be the administrator?
There will be an email sent to the administrator, and there will be a data bank correspondence. So each account will see that data bank correspondence when they log in.
So if you are not the administrator, you do need to log in to know that there is something waiting for you.
Excuse me, I'm sorry to jump in. This is Scott Rarick from SRA. I'd just like to add a little bit more to the answer there. Everyone who has in their account settings, their user account settings, that they'd like to be forwarded notifications about report output being available, anybody with that option set in their user account options will get these notifications that there are electronic report notices available. So
Great.
It won't necessarily just be the administrator. It could be numerous people in the organization.
Okay, great. Thank you. That answers our question.
And at this time, there are no further questions.
Okay, well, we'd like to thank everyone for joining us today. And if you do find you have some questions after the call, let us know. Contact information is up, or call the help desk. We're here to help you and answer any questions you may have. And I think Regina will be doing this presentation again in a couple days in the afternoon if any of your colleagues missed it on Thursday. So thanks once again, and we'll talk to you later.
Thank you for participating in today's conference. You may disconnect at this time.